I'm here at Digital Health Week, hosted by Health Informatics New Zealand, where the digital health community from across the ditch come together to make healthcare better. And it's certainly an interesting time to be in New Zealand if you're in healthcare. The event's taking place on the heels of a significant reduction in budget at the federal level into technology and innovation in healthcare. So what does this mean for the ecosystem, for the clinicians, the vendors, and the patients? I'm here recording discussions in the interview zone alongside Rebecca McBeth from HiNZ, and we're hosting conversations with representatives from industry, government, and health systems on the lay of the land in health tech in New Zealand today. Where are the opportunities to thrive given the sentiment, and where do we go from here? You'll find a handful of the conversations we've had at the event in this episode, but jump onto our YouTube channel because there's a playlist there dedicated to all the conversations that we've had here at HiNZ, which you can access on demand for even more insights from health tech leaders and experts. So collaboration starts with a conversation, Team Health Tech. Let's make it happen.
Hi Peter, I'm Scott Arrol and I'm acting CEO for HiNZ, and it's kind of like I've done my internship for the last few months. I've been the program director, so pulling together the program, the speakers and so forth, and for the HiNZ conference.
Yeah, excellent. It's always great to be in and amongst the digital health community within New Zealand, and the place to do it is here at Digital Health Week with HiNZ THT. Talking HealthTech was here roughly this time last year. A lot of conversations with the health systems and the vendors and the ecosystem. I feel like a bit's changed in the past 12 months in New Zealand. Well, maybe. You tell me, what's happened within the New Zealand digital health space in the last 12 months?
The best way I'd describe it is just it's been dynamic. Like we've gone from, probably when you were here last and everyone else was at the conference, it was quite. I think there was a good vibe. There was looking forward to lots of positive things coming. The messaging from HealthNZ and politically was positive, and then just within a short space of time, obviously things have changed, and that dynamically for reasons around the economy and direction of travel of say political policies and so forth. Just trying to get to grips with lots of things in the country at the moment, it feels like, and but we'll come through it. It's, Kiwis are we're a pretty resilient sort of a crowd, aren't we? And already at the conference, we're just finding such a positive sort of vibe around things. So people understand how tough it's been. And there's certainly a period of change that we've just all had to acknowledge, and you just got to work through that.
Well, one might think, it's an interesting time to bring everyone together to talk about innovation and digital health. But I guess when everyone's going through any kind of change, and particularly a significant change, what better thing to do than all come together as an ecosystem to work out, what it means and where to go next. So, when this conversation goes out, the dust would have settled a little bit, but, we're at the start of Digital Health Week now, so I appreciate you making the time, especially with your additional acting responsibilities now too. But tell me about what kind of vibe, or what are the types of conversations we're going to expect over the next couple of days here at
well, I think with whether depends where you are in the sector, but what I'm finding, and because I've been involved in the sector, the digital health sector, for quite some time, and in various roles anyway, what I'm picking up on is where's the opportunities. So if you're an industry partner, if you're in the business side, we've got so many that have come along. We've got the gold support of the gold sponsors, which has been great. They want to know where to position and how they're going to work, and the relationships and the interactions that are important to them, so that they can be adding value in the best places. If you're a HiNZ employee, staff member, a lot have actually paid for themselves to come. They want, they might have got the registration through their HealthNZ funding, but they're paying for their own travel and accommodation, and they want to be here because they just it's their opportunity as well. Clearly uncertainty for a lot of people, and that's that is what it is, unfortunately. And so we're just trying to provide a safe place. People can come and have a chat, get to know each other. I think it's always a good chance at the HiNZ conference. Next year we're in Christchurch at to pie in 2026. So that's going to be an even. I think that's a special vibe that we're going to be building for that. We'll be 12 months down the track. Lots of things will have happened over this coming 12 months, and I think what I've generally found, and I've been in the sector a long time. We're a pretty resilient bunch. I just keep coming back to that. So, yes, it's tough, but we're tough people. It's and everybody's working to achieve. We often say when we get to a point where digital is not referred to anymore, it's just healthcare. It's what we do as part of healthcare in the country.
And for those that are attending, perhaps in the vendor crowd or the providers, those that are helping the health systems navigate these challenging times, you mentioned too, they're keen to understand where the priorities, maybe where the opportunities are to be able to help the clinicians, health systems work in these turbulent times. What are the types of advice or suggestions you have, given that there's not ample budgets for investing into new technologies? Is there still opportunities for these companies to support during this unique time?
Yeah, there is, and I guess I've had a mantra for a long time anyway, and it's about relationships. Who are you working with? Who are you not working with? Who perhaps you should be? Just what is it that the sector is going to be able to? What are they going to need? So that's, and I think it's. We've gone through a period where the wording has all been around innovating. Like we've got to innovate and not to belittle that, but I think we're now entering a period of what have we already got, what can we improve on, where are the connectors. I think there's a huge opportunity for industry players who are connectors. They've got their own system, but they connect with other systems. Standards-based is important. I think it's fundamentals. That's what, in a way, in a good way, sort of back to the future type stuff. It's where's your fundamentals, and I think improvement. There's going to be a period of just sticking to the knitting. Let's get things improved. Innovation will follow once the platforms are set.
Yeah, building that foundation and getting the basics right, and there's still a lot of work to do in healthcare to do that. So yeah. And lastly, for those that are thinking about the future, is it continuing to do a lot of that? Perhaps the health systems too. They're under there'll be more pressure in terms of needing to do more with less. And we've always talked in healthcare about the need for increased digital literacy and people to be able to use technology better. Are you finding there's more interest in technology, or perhaps the types of people that would be attending here at HiNZ to try and address some of these challenging situations like that are in New Zealand right now?
Yeah, absolutely. I think there's a truism now that, and it's going to get even more true, not less, regardless of what's happening at the moment. Is digital's here to stay. We're not. There was a period I can remember where we were almost trying to convince that digital was important or should be included. Now everybody gets that. The next stage is, how do we get that to that point where it's just embedded? And clearly we've got to get the fundamentals right in certain areas. But literacy is incredibly important. I think trust. I think trust is huge. I think when people, I've seen the trust factor get better. As I say, the last 5 years, but I think it's still got. We've really got to ramp that up. We've got to be able to ensure patients or the citizens understand, hey, I can trust this, and I can trust the people that are behind this, and that has to be based on standards and just getting those things right. And with the advent, of course, of AI and how that's going to play out over the, because with the whole Moore's law thing. We're really, it's almost like that curve's going vertical now,
Yeah.
And and that brings a whole more factors around trust. How do I trust this? Has it actually even been created by a human? So we're going through quite a fundamental shifts in our society. So digital health has got a big part to play in that.
You sure do. Yeah, it's not an optional extra anymore,
no.
That's for sure. And that trust piece is critical. And if we're in a vibe of needing to do more with less, obviously inefficiency through large language models and AI are going to play a key part. Any final thoughts before we let you loose amongst the attendees at morning tea here?
Final thoughts is just stick with it. Like it is always, when times it's, I don't want to be into too many cliches, but there are always opportunities. It's finding them, and who are you going to? I just keep coming back. Who's the relationships? Who are you going to work with? Who aren't you working with now that there's the possibility you should be working with? And just make sure whatever is done builds trust, doesn't erode it.
All right, well, kia ora, ko Martin Chadwick aho, ko Tia Piha Hawara Homies, so Manatu Hawara, so I'm the Chief Allied Health Professions Officer at the Ministry of Health. Thank you.
Oh. Hi, ko Charlene Tan-Smith toko ingoa, te kai matai putayau a Parongo toko mahi, so I'm the Clinical Informatics Consultant for Canterbury and West Coast.
Thank you so much for joining, and great to have you here. We're here at Digital Health Week New Zealand in Hamilton. What brings you to the event?
So mainly it's to have an opportunity to touch base with some of the allied health folk that have got a real focus on data and digital. So that was the focus of the workshop this morning. I think it's not often that you have the ability to get people together that really have that focus and be able to have a chat. What is the role of data and where do we need to focus the data and digital space specific to allied health?
Yeah, amazing. And so do I understand correctly, you're at the overarching level and you're at DHB? Is that right? Have I got it right in the close?
Yes. I would say Martin would be the overarching Ministry of Health governing, our allied health professions. And I'm attached to what used to be DHBs and
yes.
now we're region and districts. Yes.
Got it. And so tell me a little bit more about what the need is in the allied health space for perhaps overall and then specifically for your particular region.
Yeah, and I think that was a lot of the conversation that we had this morning actually, is understanding that when you look at the way the health system unfolds now under the new legislation, that the Minister of Health gives really clear direction around the government policy statement, what he wants us to focus on. Health New Zealand has to then write the Health New Zealand plan, but it's a matter of how do Allied Health, how do they read themselves into that? And I think that that's what we didn't have, is the opportunity to really say, this is the direction to travel, what are the opportunities that sit within that, and how do specific professions or groups, how do they think they can start to contribute to that? And then I think it comes down to the granular level of really being able to demonstrate and prove this is what we can do, which is where we have wonderful people like Charlene that can really dig into that and demonstrate their worth.
Yeah, as you can imagine, as like what Martin said, as a leader, he sets the direction like how you would for a ship. Right, we have our 5+5+5 targets. So the part that I really like is that I'm right down to the coalface. I'm all the way to the top. I try to figure out what digital pathways or what workflows need to be digitized and what we can do in the innovation space and with tech, and how can that enhance us but yet have a complete clinical lens for it. Because we are the ones that are the administrators. If you were to see in terms of innovation, Allied Health is also at top when it comes to finding different ways of working, finding good ways on how to be efficient, finding ways on how to show our demand and the outcomes that we know that we need to achieve and supply. And that's how we work pretty much like a rugby team, isn't it? That's the part that I really like about my job, is as high level as I need to generate those reports and those strategic movements of where we're going to do, align, standardize what is it that we need in allied health. But I like that I still get to go right down to the ground level, to, in a sense, to frontline with patients, frontlines with clinicians. Is this what your data is really telling us? I'm teaching them how to use data as their voice, but for them to be able to do that, they need to understand what they're contributing.
Yeah.
So that journey itself, it's so exciting.
I love that. Use data as your voice. That definitely resonates. And very New Zealand of you to throw in a rugby reference there. So kudos for that. But it is interesting thinking about the needs of allied health from a digital perspective, because you say allied health as if it's a homogenous group of people, but there's not a profession within healthcare clinically that is diverse as allied health. There are so many different modalities and professions within the allied health space. And that you think about the bespoke needs of from a patient side, but also just from a clinician perspective. There's group bookings, there's very different kind of physical and virtual elements that are there too. Do you think what brings the allied health needs together is the fact that everyone is so diverse, or how do you approach such a large group of clinicians that in their right are their own little groups in themselves but then get grouped up into this need? What brings all that group together that has quite a unique need compared to, say, your general practitioners or your specialists or other clinical needs?
Yeah, and I think, many ways you can look at it. How I try to make sense of it is that it purely is a social construct. If you don't want it to exist, it doesn't exist. But then you look at healthcare, you have the traditional power base that sits with medicine, it just is. And then you've got the sheer numbers of nursing that sit behind that. Again, it just simply is. And so then you've got this group that could be very disparate, but together, there's real power within that. In some ways, I kind of think it's almost like, to use another rugby analogy, is that, you might be playing for the Bay of Plenty Steamers or, another provincial team, but given the opportunity to wear a black jersey, you want to wear a black jersey type of thing. So it's about understanding that it doesn't take away what your background is, but you can also wear the black jersey and you can also have that allied health banner that you operate under. And I think that that's the opportunity to really put that forward. And from my context, it's the opportunity to continually put forward that there are solutions. And there are solutions that sit with audiology or sit with speech language therapy or sit with osteopaths or sit with et cetera, et cetera, et cetera. And to be able to say, what is the need of the system? What is the minister setting out within that GPS? And how can we start to offer some of those solutions? So that's what I've got the ability to do within my role.
Excellent.
Martin is going to laugh at this, but I've always described allied health, like everyone is going, what is allied health? No, it's not doctors. No, it's not nurses. No, it's not ambulance drivers. Martin is like my farmer. He would laugh because I often say that I inherit a farmyard and I love all my wonderful creatures and animals, right? Because all of them have different numbers, they work at different speeds, they work at different ways, they have different workflows. But you know what? I know what the commonality is among all of them, right? So Martin knows all of us and what we do, what we can provide, what we are useful for, what's our superpower, right? So that's the key. I find that the part that really excites me is that often with different types of animals or different disciplines with different ways of working, some might be a lot more efficient and quite good at doing certain things. I'll like, great, you know what? I need you there. I need you right there. And then after that, I go, okay, come on. The ones that need to be handheld this way. No, I'm not going to leave you behind. I'm going to be only as fast as the last person, right? So in some ways, I think that's the excitement that keeps me going. That's the challenge. I love challenge. And everyone who knows me know that I don't do anything unless it's fun. So, to actually gear on and to actually cheer people on, to kind of reach to that common goal. Again, it comes from the top. That's the direction. That's the goal we're trying to go for. And then it's as clinicians, from top scope, for me to give them the tools to be able to do what they need to do to get what they need to provide and the outcomes, to be very clear on that. And that's the part that I like. I like the... Martin's going to laugh again. I like the landscaping, not so much the lawn mowing, because I'm not very good at lawn mowing. Just like I'm never going to be a coder. I tried, it killed me. And I know I can do it, but I know I do it quite shittily. Do we have to cut that out? Oh my goodness, can I even say that? But I like helping the top leaders to strategize on how we can get what they need us to do.
Yeah, excellent. I mean, we can continue on that agriculture analogy about resilience and about making the most with the resources that you have. But we can park that one for a moment. Lastly, I was thinking about, you mentioned you ran a workshop today and you're here kind of fleshing out the needs in the allied health space. Are there any kind of key takeaways or things that you would hope that people attending the workshop or just more broadly the event that might take away you'd hope that, really encapsulate what the needs are in the allied health space or where the priorities are within New Zealand and particularly your region too?
Yeah, and I think what I really tried to lay out in the session I was able to talk to today is that this is a very dynamic time, and I know that it's quite hard for a lot of people, but within that there's actually been some quite seismic shifts which has allowed Allied Health to start to do more than it ever has previously. So that's really, really exciting for me, and I think the really clear reality is that we just can't keep doing things the way we've been doing them. So we need to look at how do we innovate, how do we use our workforces in different ways, and some of the enabling functions are changing. I won't bore you with the details, but there's technocratic things in the background that have changed, and that's allowed Allied Health to do more. I've seen more happen, this calendar year than what I've seen the previous 4 years that I've been in this role. So while it's challenging times, it's acknowledging that, but it's also exciting times, and it's trying to make sure we hold that narrative that there's always the opportunity that sits within it. It is up to us collectively, and certainly for those that do get to go up on stage, that's what we've got to be able to we share with people, that there is some positivity that sits within it. Got to embrace it and trying to shepherd, if I can use that, in a really positive way, that there are opportunities that you can go about stuff, and that's what we can do, is that we can provide some of that guidance. Yeah,
absolutely. I would say a lot of our colleagues have, and my council members as well for NESTIC, Allied Health, Scientific and Tech, Informatics Group Council, have also going through really personal and professional trying times. However, just like when we do go through trying times, all the more, we need to stand together. All the more, we need to support each other. And exactly like what, Martin is saying, I look forward with excitement, but not to the excitement that, during a really tough time. It's about help them with the grieving. But then now what we can do is we get together, collaborate and move forward to create opportunities. By helping to look forward, to move forward, can give them hope. With hope, we'll have really great things that's going to come out from it, because all the innovation, I still feel most of the innovations would have come from Allied Health, because we're usually so used to be given very little. And just like New Zealand with the number 8 wire, we get very inventive sometimes when we put it under pressure. With the very little that we have, I hold hope that we actually be able to create really good opportunities still next year. And that itself can help to shine a light a little, because what I look forward is the future. We can't do anything about the past, but we can still do something about the future. How about work together with us to find a way forward together? And if we can help, we can help. And by doing that, hopefully that might shine just a little glimmer of light in this really, really tough time, that when one door closes, another door would open.
I'm the Chief Health Officer for Salesforce, Dr. Bryan Tan. Have been working with Salesforce all throughout since the COVID response. So we've been working with the ministry here ever since, even before the COVID response, but we were being used very meaningfully as part of the contact tracing work that was being handled over here. The vaccinations, as each individual consumer was booking their vaccine appointments, and the workflow for a lot of the vaccination program is on Salesforce. Since then, we're the Aotearoa immunisation register for the entire nation. A number of the infectious diseases have also been added to the surveillance capability. Things like rheumatic heart disease is being tracked on Salesforce. And there's a host of regulatory kind of practice use cases as well being used in Salesforce. So Salesforce has been helping New Zealanders for a while now, and we're here to stay in a meaningful way, and we're here to help.
Great. And you presented here at the conference. Tell us a little bit about that.
Oh, it's been a pleasure actually to hear all of the presentations, and also have a lot of great conversations and catch-ups with the people that I've met over the years here at HiNZ. What we presented was what are some of the global headwinds in health? What are the challenges that health systems both here in New Zealand and everywhere are facing at the moment? And it's striking how similar those challenges are. Some of the thematic consistencies here in New Zealand, across the states, in Australia, in Canada. A lot of our nationalised health systems are facing a threefold challenge in terms of budgetary constraints and the overall government ability to spend on budget, but then its impact on health specifically as well. Global workforce shortages and how they're playing out across all of the patches. And that's creating a mathematical impossibility. It's resulting in things like lack of access to GPs at the front end of the line, and then further upstream or downstream, the way you see it, ED ramping, so backlogs of patients waiting in the emergency departments, backlogs of elective surgeries globally as well because of some of those global shortages and lack of resources as well. And then thirdly, the shift towards consumer centricity and the rise in consumer demand. So we do a lot of intergenerational research with healthcare consumers here and around the world, about 16,000 of them. And what we see is a definite shift across the generations, but particularly so with the younger generations towards democratization of their own decision-making in health and self-information seeking before they even seek the advice of a healthcare practitioner. So a lot of breakdown in the old hierarchical models of health. And that then has downstream impacts on the culture of clinical staff and how they provide care, how they talk about care, how they involve the consumers in decision-making as well. And then the systems and the technology required to support that change in culture as well. So 3 big shifts: budget, workforce, and then the shift to consumer is global systematic themes across all the health systems that we help.
Fascinating, thanks. I'd love to hear a little bit more about how Salesforce supports the infectious diseases surveillance. How does that work sort of in the background?
Yeah, so we're the registry for, because we're a bit of a Lego set, we're not just a single point app. So when it was deployed for COVID contact tracing, for example, the fact that the platform is so highly configurable and it's actually Lego pieces that you can build together, it's a logical extension then to not only serving one pathogen in COVID and coronavirus, but then also potentially for rheumatic heart disease, for monkeypox, and any new pathogen that's going to come along, and you need to skill up new care pathways, new protocols for care specific to disease groupings in infectious disease. It's easier to put it on a low-code platform where you can craft a new workflow within days, not months. So that's really the value of the new technology that's coming along. In a low-code studio environment, you can roll out a lot of these solutions far quicker than you ever could, which is a revelation for a clinician like me who's used to, say, 10 years ago having systems which say 3-year-long projects as opposed to 3-day-long projects. That's transformative. That is truly revolutionary and eye-opening. We also serve the New Zealand public in terms of the integration piece, and integration is one of those gnarly problems in health that has been around ever since we've had technology systems in place with different proprietary data models in the back end and then also different configuration of workflows. How do you build better connectivity so that clinicians working in primary care, secondary care and tertiary care can better communicate and coordinate with each other without necessarily the direct conversation or the benefit of being able to yell across the hall, "Hey, can you take a look at patient in bed 21, please?" But now working in patients' homes, community centres and that shift left, how do we still enable good, effective technology that helps you with that instantaneous communication and collaboration and coordination? So that's also a key part of what we're trying to provide. Through the HERO project, we play a big part in the spine of that ability to talk between the subsectors in health, between clinicians at the coalface, allied health, being able to exchange information through HERO.
Well, it sounds like you're really tackling all the key points, and it's great to hear that a lot of the technology spun up during COVID times is now being able to be expanded into other important areas. I think might be used for measles perhaps as well, and we've just got a whooping cough epidemic happening as well. So it's all, health has always got something coming around the corner, so it's good to know there's technology there to help us track it and that we've learned from the pandemic.
Absolutely. I think the pandemic gave us pandemic privilege. So we had a lot of special situations where government regulations allowed for fast-moving, agile workflows to be rolled out. And now that the pandemic is over, I see a distinction between those health systems that have realised that there is now everything's changed, and those health systems which still believe, no, it's BAU, we're back to normal. Those health systems which still think it's BAU will not have leveraged the learnings from that pandemic privilege. But those health systems that have realised, actually, we've got new tech now that we can deploy new workflows. If we need to change things, we can quite quickly, at speed and at scale. Those health systems are where I see there's going to be much faster trajectory of progress and advancement of the ability to use technology in the piece. So we're looking for those kind of health systems who are forward-thinking that way, have realised that everything's now changed, including the tech. I mean, really, AI is on everyone's lips. at Salesforce, we're focusing on agentic AI, which is the next evolution beyond co-pilots, and the ability not just to suggest back what the next logical course of action is and provide some decision support with human at the helm, but instead to actually enact some of those actions as well. So in the process of following up a patient, say post-cardiac stent, not only suggesting, get in contact back with your GP and try and ensure some follow-up, but potentially to actually proactively send out a message to the GP saying, are you aware your patient has already been discharged from hospital, and send a proactive engagement journey to the patient themselves as well, or their carers, depending on the information that you know about the person. So that agentic AI capability to not only suggest but to act is what we're excited about for the next future. And it's going to be highly important as we need to do more with less globally. So we're trying to see how that agentic AI can be brought to bear in a really valuable way for health as well.
Great, and certainly I've seen a very busy booth session, so people are keen to hear about that agentic AI as well, so it's great that...
We had a silent disco, so I think everyone saw the headsets and thought, let's take part,
Great. Oh, well, it's been fantastic to have you here, so pleased that you've added to Digital Health Week NZ, and kia ora.
Kia ora, thank you.
I'm James Field. I'm a Program Director at Te Whataora Health New Zealand. And most recently in the last year, I've been working with ServiceNow to the rollout of all ServiceNow to all our service desks across the nation.
Excellent, thank you.
And I'm Kate Tulp, and I'm the Country Manager for ServiceNow Aotearoa New Zealand.
Thank you, Kate. And so, it sounds like you've undergone a bit of a digital transformation journey, and undergoing that is always a process and requires resources and time and attention. And I feel like it sounds like you're at a point of reflection. Tell me a bit about what that journey has been like in implementing ServiceNow into your setting.
It's actually, a fitting way to talk about it. It's a real reflection point now. We set out a year ago to address some of the challenges we had across the service desk. So I think the most common terms I'm hearing while I'm here is siloed and fractured. And when I joined a year ago, it definitely was that. We had 16 service desks working in different ways on different systems, and we really lacked an understanding what they were doing and how we could drive value for the clinicians. So that was the real kind of starting point for us, and we set a vision of how do we unify that, get it all in one place and have the data available for us to make the decisions to improve how we act, but also, by that point, even a year ago, AI and that was coming through, how do we actually get ourselves into a sound position to benefit from some of those and move forward with it? So, reflecting on where we were a year ago, it was a challenging environment.
And so, I'm trying to picture if not for the solution, then what would the situation be? Like really kind of drilling into that problem to solve. I guess, what does that, now you're at this point, what does that transformation look like into where you've gone to now, if you get what I mean?
From, right on the onset, we said, look, we're going to go a crawl, wall, run kind of approach to it. And where we are now is crawl. But when I kind of reflect on what does crawl mean, what has it actually given us an advantage? It's given us a single view of our network. We can see where the work is, we can see where the demand is, we can find ways to improve and use the technology we have to drive that. But on top of that, we start to set ourselves up for, what comes next. How do we actually go with technology moving so quickly that we're actually in the best position to, deliver even more impact for the clinicians.
Yeah, absolutely. And, from the ServiceNow perspective, working with Health New Zealand and helping with that transformation journey, it doesn't sound like something that's a jump online and, subscribe yourself and set yourself up. There's a fair bit of process and understanding the problem to solve. How does that fit in with, the services that ServiceNow provides, and what does that mean for you?
Yeah, so we are incredibly proud of the journey that we're on together with Health New Zealand. Health New Zealand has been an incredibly important organisation that we've worked with for a number of years, pre-merge of them all coming together and now as this one bigger entity. It is an incredibly important project that James was talking about. It might sound like it's a really standard foundational kind of thing to roll out one national service desk, but the way that James and the Health New Zealand team have done it has been nothing short of extraordinary. So I'll tell you a little story and you can choose to keep it in or not. So a few years ago, we were running a conference and we had one of our original founders out, Pat Casey, who is an incredibly clever man and legitimately has designed the platform from the ground up. And he was out at this conference and I introduced him to a couple of people from one of the district health boards at the time, and it was pre-merge. of all the entities coming together. And we walked away from that meeting and Pat said to me, gee, that's a hell of a project and it's going to be amazing, and I believe that they will pull it off, and when they do it will be incredibly important and it will be something that the world will want to know about. And so when we look at what these guys have done, we say it is in fact important. It was important for clinicians to give them back more time to spend with patients. It's really important for employees who maybe aren't clinicians within the hospital environment to be able to access information and get their problems solved quickly, and it's really important for the people who are supporting all of those employees and clinicians and the IT teams to be able to do a great job. So yeah, it's for us super important project.
It's great to be able to put it in that perspective. Look, question without notice and kind of wrap up as well. You know, we've been at Digital Health Week for the last couple of days, and I see ServiceNow have got a good presence on the expo floor, and I'm sure involved in sharing some perspectives with attendees too. What do you take as the what would you hope that attendees kind of walk away from the sessions and everything over the last couple of days, particularly given the lens that we've got now of the system that and the situation we're in? What are you hoping that they walk away from the last couple of days with?
Ambition. True, just outright ambition. We're really good in New Zealand at defining the problem and talking about the problem, but there are plenty of solutions and ways that we can get at the things that matter the most in delivering public health care in this country, and we're very excited about that. So I just hope that everybody walks away with ambition and inspiration from coming and listening to people like James and Andrea talking about what they've managed to achieve in a really short time frame at Health New Zealand. And if you can do that across a complex government organisation at pace, then I really believe that anything is possible.
Yeah, Liam, any thought?
Beautiful, Kate. Ambition is exactly what we're looking for. We've got to think bigger and we've got to get on with the job. So, rather than kind of repeating what Kate said, I think it's, we are all in the waka together. There is not one entity that's going to be able to solve that. And it's a great testimony to ServiceNow. Strategic partner is a bit of a cliche. Everyone puts in their RFPs, everyone says they're going to be their partner, but ServiceNow turned up, understood us, made the decisions that were right for us, created commercial constructs, and every time we went to them with a problem, nothing was a problem. They were always there to fix it. And I think it's that kind of strategic partnering coming in and supporting us that has to happen. And we just need to, how do we create the ecosystem? How do we create the scale around that where everyone here knows that we've got the big problems to address? Let's do it together, but let's start today.
Kaveh Safavi. I'm one of the global leaders at Accenture. I'm a doctor by original training. I spend my time working with organizations trying to help them understand how to combine the promise of technology and human ingenuity to solve big, hard, intractable problems. I've had the pleasure of working in about 25 countries over the last 2 decades. I work with every kind of organization, providers, funders, governments, companies that are trying to figure out what to do in healthcare. It's been a very interesting professional life.
Yeah, you certainly bring that global perspective. So what brings you here to Kirikirioa, Hamilton?
Well, so we're rebuilding our presence as a business here. We've been here for a few years. I was here last year at the same event. And just because it's such an important event for the leadership, both the private and the public sector, it's an opportunity to hear and share what people are doing and thinking. So it's always good to be here.
Perfect. Delighted to have you. So tell us a little bit about your plenary presentation this morning.
So I was specifically asked to address the issue of how technology is affecting work. The context fits very well with the priorities in New Zealand. As Commissioner Levy yesterday said, the top 3 priorities, the first 2 were an access problem, a waiting time problem, and a labor productivity problem. Every country I've been to this year, it's the same issue. I've been in 5 continents and 14 countries in the last 12 months, and the issue of access and labor productivity have become the number one healthcare system issue because of demographics. And so we see this problem of the demand for care growing faster than the supply of caregivers. And the question is, how are we going to close that? Because if we don't, we're going to have a serious societal issue of a lack of access. Our hypothesis is because there's not enough human beings in the workforce, you're going to have to take what people do and use technology to actually scale human capacity. The jobs that technology can do go to technology, leaving the humans to do the things that humans can do. That's the mental model. We did not really have a good answer for it until generative AI showed up, because generative AI gave us the ability for technology to take over language tasks, reading and writing, which turns out to be 40% of all tasks for all jobs. Within healthcare provision, it's in the 20s. that gives us the ability to give people time back, as much as 20% of their time, so that they can do other things, including serve more patients. Because ultimately, if we did it the way we did it, people would have to wait. And the implication there, though, is not only do you need the technology, but you actually need to change the way the human works, because you've actually reorganized their task lists. So jobs are different, organizational structures are different, and the skills of the people are different. And so I covered the implications of the problem, the nature of technology, and then how the work has to change in order to reflect and gain societal benefit.
Yeah, it was a fascinating presentation. And yeah, I think that you put up a slide, saying if we had 10 nurses, how might we rearrange this?
Yes.
And so you had 6 nurses still, and then 4 bots or AI agents. And I thought the most interesting thing was that those 6 nurses are going to be doing a different job.
Yes.
And so the leadership of that and understanding how to lead a team that includes both humans and agents or bots is going to be very different as well. And it's all a cultural shift and a mind shift.
Right.
And so how do you sort of go on that journey?
That's actually the hardest part, the change management. The technology is the catalyst. It's necessary but not sufficient. The presence of technology, if you just added and didn't change the work, you actually make things worse. We can call this broadly change management, but it has many levels. So like, for example, the first level we're seeing is an immediate need for a basic technology vocabulary, or technology literacy for everyone. An organization in the U.S., for example, that's trying to bring virtual nursing in, and I know this organization, the leader there, the clinical leader, told me he realized that the nurses don't understand the words. So he needed to introduce basic technology literacy, like when I say virtual nurse, I mean X, before he could introduce it to them as far as their work. And we're seeing this in every industry, is technology literacy is becoming a basic requirement for people in their jobs. The next level that often it comes into play is who's in charge of solving this problem for me? The traditional organizational silos, I have an IT department, I have an HR department, those departments can't be responsible for this. The operators have to be, but the operators were never selected for this skill set. So I had a CEO of one of the largest health systems in the U.S. tell me, Kaveh, I understand what you're saying. My problem is I don't know who to give this problem to. So we're starting to see organizations address their broader operating model. Who do I give this job to? What are their skill sets? What's the transitional model? Where does change occur? That's all happening at the same time. The technology is just arriving, so the nature of changing individual jobs hasn't really begun, although it has begun in some areas, like physicians have more experiences with the ambient documentation or inbox management. They're getting some time back, so they're starting to learn what to do with it, but that's kind of the horizon that's still to come. So we're really in the early days of this. I think this is a decade of effort.
Yeah, and you spoke about how healthcare's, if not one of the only industries where the addition of technology has actually reduced productivity, which I thought was really interesting. 13% of time taken up by taking notes and typing to a computer. So we have, we are at the early stages of adopting AI scribes, medical scribes into healthcare in New Zealand and overseas. Is that sort of the first step into this transition then?
Well, for physicians in particular, it's a big time relief for them because it does 2 things. It's not just a transcription. If you think about the way a doctor today works, we have a conversation. I'm a doctor, you're a patient. We have a conversation. And then I stop and I intentionally recharacterize what we just said into a note, and then I document that note. The machine is doing both of those things. It's listening to our conversation in real time, and it's recharacterizing it. So it recognizes that something that we said in minute 1 and something we said in minute 18 are actually related. It's not just a verbatim recording of what happened. It's the way I would stop and rewrite the note in an organized fashion. Yeah. So that's a very different kind of a thing than simple transcription. But it actually goes beyond that. So it gives me that time back, both the thought time and the type time. But it also can take that information, and then from there it can push structured information out. So the information I need for analytics, decision support, all of those things which is why I made doctors type, it generates that.
Yeah.
So we're getting the narrative and we're getting the structured data out at the same time.
Yeah.
It's pretty powerful.
And in terms of what people can do to start planning for this change and make sure that it doesn't sort of happen to us, but it happens with us? What kind of advice do you give around that?
Well, it's going to be hard to happen to us because it's really about our jobs. So we're seeing three kinds of things happening. The first one is all of this stuff sits on a basic technology foundation that, frankly, healthcare as a general statement is underinvested in compared to other sectors. And then at the country level, it's even more underinvested. New Zealand, as an example, on a relative scale of rich countries, is more underinvested than other rich countries are. So no foundation to build a house. So this becomes a real call to action, because otherwise we're going to admire these technologies as they become available because we have nothing to rest them on. So that's the first one. The second one is that because we're going to be using artificial intelligence, and artificial intelligence has a number of implications, we actually have to have a perspective on responsible artificial intelligence before we bring the technology in. And this idea that you have to think about that in advance is not usually the way most of the time people played around, experimented, and then maybe they got around to responsible artificial intelligence. But the truth is that the choices you're going to make about how you're going to use technology, where you're going to use it, what you're going to use, has to be anchored in something. And if you don't have it, and I've seen this, organizations, technology organization or innovation organization ran ahead and said, hey, look what we can do. But then the organization's compliance and privacy group said, I don't know what you're talking about. We are never doing it that way. You got to go rebuild the whole thing. We never had the conversation about responsible artificial intelligence. So that's an immediate thing to do while we're waiting. The third one is this issue of who am I going to give this problem to? To have a theory, and that's a chief executive level kind of a problem. That's not a ground level management kind of a problem. What we're realizing now is that this transformation only works if the chief executive or the chief executive type people believe it's their biggest problem. All of the organizations in every industry that I've seen, not just health, that are the farthest ahead, the loudest cheerleader is the chief executive.
Welcome, Lara and Lisa, to the Talking HealthTech podcast. Can you tell us a little bit first about who are you and what do you do? Starting with you, Lara.
Kia ora koutou. Lara Hopley toki ingoa. I am an anaesthetist by trade and temperament, but I'm working currently as the Chief Clinical Informatics Officer for Data and Digital Te Whatuora Health New Zealand. What do I do? It's a good question. So clinician first and foremost, and continue to actively participate as an anaesthetist 1 day a week. But otherwise, I think what I bring is a translational element between clinical and technical, so that we can actually deliver to the clinical workflow, to the coalface, actually good things. And I think I'll hand over to Lisa now, because I think she's somebody who's walked in the same shoes.
Yeah, thank you. I'm Lisa Knowles, and I'm the nurse manager of the district nursing services across Nelson Marlborough. And I was the clinical lead on a project to configure and develop a patient management system specific for district nursing that we then implemented, and we've been live with the system for a year now and has been incredibly successful. Yeah.
Amazing, thank you. And we've got you both here today because HiNZ, in collaboration with the Clinical Informatics Leadership Network, launched an award, and this is in its 6th year. And this year we have Lisa as our winner, so we were delighted to have that. And our 2020 winner was Lara, and our judge this year. So, but first, I've just used the word clinical informatics there. If you can just tell us, what is clinical informatics for those watchers and listeners who might not know?
Kira, I'll go with I'll try and start first. And it's a really good question, because I think that it's an evolving and developing science within this country. I think that there is clinical informatics outside of this country, and they take on different roles and mantras over there. But what are we developing and making clinical informatics here? So clinical, that it's about clinical, is what I take the clinical to be. Yes, we often have clinicians coming into technology, but and so we often sort of say, is there only clinicians who can be clinical informatics? But clinical is about clinical. And informatics is the science of information flow. So clinical informatics is about the right people, making sure that you get the right information to the right person in the right place at the right time, in their right workflow, so that you can actually go through the ecosystem. So it is more of a science than it is an art. But like all things in medicine, there's a fair amount of art in this science. What do you think?
Yeah, I agree. And I think as a nurse, I've definitely come into this project with a clinical hat on, and I thankfully had a project manager who led me through this project and, opening my eyes to all the different work streams that needed to happen to implement a system and a solution that was clinically focused, and I provided that clinical input. But all the other aspects of it, he kind of kept me on task with, and I've learned so much. And now the data and reporting and the information that we're now getting out of a system is giving that visibility of what district nursing is doing as a service, and kind of, it's been hugely important. And now it's like the project is like now successful, and we're getting out of it what we need. Yeah.
I just want to say, your passion is shining through, which is just lovely. And B, the bit that you put in there, that it's actually a partnership with the rest of the digital team, and to allow each area to actually give its strengths, and you do the strengths where you need to. And so it's a combination of active leadership, but actually active followership is what I've heard from that there. And that was just beautiful. Thank you. That passion was just shining through.
Thank you both. So I think people would love to hear a little bit about your journey, how you came to be taking on a digital role. You're obviously a nurse and an anaesthetist. How did you come to be here today?
Yeah, thank you. So I've been in the district nursing space for 15 years and in a nurse manager role for the last 6. And it was very obvious about 3 or 4 years ago that we as nurses were working across multiple systems that were inefficient, and we had an old district nursing database that just wasn't giving us what we needed in terms of visibility of what we're doing out there in the community. So we needed a solution that was going to be more efficient and was going to be able to give us the data and show us our workflows and being able to organise what our nurses are doing out there in like quite a lot of rural areas as well as the urban. So I very much became involved in this project to find a solution, and we worked with Valencia as our base program, and we built on that and configured a system that's very custom to district nursing in the community, because there was nothing on the market that was going to give us what we needed. So it's now sort of evolved into me being very much involved and sort of now taking the lead in our team in terms of managing that IT component of our system.
Would you say you're a natural technology person, a bit of an IT geek, or is it a bit of a new world for you?
I think it's brought out that side of me that I kind of think was there, but now it's very much in it. Yeah, I think so. So I definitely enjoy it, and it makes sense to me. And I think being able to bring that nursing lens to that has been a really nice combination. And also the implementation within our team to ensure we had the engagement of we had 100 nurses that needed to get up and running on a very new system that's very IT heavy, like there's a lot to learn within it. But we had that engagement with them because they understood what we were trying to achieve, and there was very much a clinical nursing focus to what we were doing. Yeah.
Lara, how about you? How did you come to be where you are today?
Oh, kia ora. So I think maybe I'll start with how I became why I ended up being a doctor, because I think that helps with the story. Was can remember being a patient and going, actually there's a massive power in difference over here. The way to overcome it is actually become a doctor, and so I became a doctor. For probably the wrong reasons. I think I've stayed a doctor for the right reasons. I actually really love doing the clinical side. But then a very similar thing happened was they had a piece of software that they wanted to roll out. I'm an anaesthetist. We tend to be techie people. To be perfectly honest, I thought, gadget girl, roll out software to other gadget people. This is going to be easy. Not. And so that was probably my first experience where, how do I didn't want the power imbalance. Maybe it was that I had a little bit of access envy and wanted to have all the tabs that they had open. But I think that it was about the power imbalance to a degree. And it was also making sure that we were both talking the same language within clinical and digital. Because often we'll have I like fish conversation. I like fish, do you like fish? I'm talking about fish swimming. you're probably talking about fish on a plate or vice versa. So we can agree on something but actually be talking about two different things. And I often find that that's what happens between clinicians and technicians. They're actually talking the same words but different languages. So I think that I went, okay, I'm going to learn there in order to do that. What I discovered, though, and again, it's part of that partnership, is what I discovered is that they're actually digital people, technical people, who spent a lot of time in and around clinicians and actually have as much or more clinical insight than clinicians. And so knowing what was on the other side, and learning to translate and learning to do those. And so learning to actively listen is kind of why I think I found my passion within this.
Great, thank you, Lara. And obviously you were a judge this year and last year for our Clinical Informatics Award. Thank you for that. What did you think? We had 15 nominations. They're from across the matter, a lot of different people and a lot of different clinical specialties, all sorts of different sort of technical expertise as well. Were you impressed, amazed? How did you feel about the calibre of nominations and our 3 finalists?
Thanks, Rebecca. Good question. I'm actually trying to figure out... so I don't know that we were so much as a judge as we took the original ones and we got to choose the 3 that we thought were most outstanding over there. And then, as you know, it's actually the people that you're serving that actually chose you as the winner. So I think that you've got to take that as a massive kudos. So it wasn't us who chose you as the winner. It was actually the people that you're serving. And that's kind of probably, again, why we do this is the buzz that we get out of doing that. But that you've actually helped somebody is who judged you and where you got to. But in terms of your specific question, I think I've done it since 2021. And so I think this was the 3rd year that we've done it. And so what amazes me is that every year there are more people. And every year I look at what people have done and gone, oh my goodness, I need to contact that person and find out more about what they've done. So part of why I do this is actually this is the thing. How do we make sure that everybody knows what everybody is doing? So I'm very privileged to have been sat there, and every year I've gone 1 or 2 or 3 of them, I've gone, I'm going to reach out and talk to that person about that. So there's a slightly selfish reason as to why I do what I do. But I think I've admitted that. So that was part of it. And the other thing that struck me probably more this year than any of the other years was that the different types that we're getting new entrants who've done something new and just within there. And I think we need a way to encourage that. We've got people who've been doing a little bit and are starting to spread and actually starting to go outside of the area. So doctor, nurse, allied health. But actually realising that you can go across disciplines within that interdisciplinary nature that some of the clinicians are starting to bring to, and then some really seasoned senior people. And so I think that just sort of hopefully we can see an evolution of this award to start going, we've got so many, and you can start seeing the themes that are coming out, and I think we need to encourage at each level. So that's what I found about this year judging. Thanks.
Absolutely. And obviously you're here at Digital Health Week. You didn't know if you were going to win or not because it was put to a public vote, but just last night you were announced as the winner of this year's award. How was that for you, Lisa?
Yeah, it's been amazing. This whole process has opened my eyes to a whole new world of informatics that I was sort of not really aware of, having very much just worked on this project. And kind of like we all do work in isolation, as you say, and it's like understanding that there's so many pockets of incredible stuff going on around the country. I was proud to have even been nominated by my manager, and to have been the only nurse finalist was huge, and even that was enough. So to have won, and I know that there was a huge amount of nursing support behind me, that's, really proud of that, and proud of my whole team for getting me here and to support me to do what I had to do to get through those few years of implementing this program. Yeah.
Well, HiNZ is delighted to have you here, to be hosting you at Digital Health Week, and to have been able to highlight the awesome work that you do with your award. And I'm sure that we will continue to follow that through as well through eHealth News and our other media channels and hear how it progresses. So it's been great to have you both here with us. Thanks for your time.
Thank you.